been telling you all day, Governor Charlie Baker announcing today that the state will roll back the reopening in our state. And here to discuss that with us is Dr. Todd Alleran, of course, Chief of Infectious Diseases at South Shore Hospital. Doctor, we always appreciate your time. This rollback means that we go back to step one of phase 3. It calls for reduced capacity in a number of businesses, more stringent mask requirements. What's your reaction to this?
You know, Maria, this is necessary, of course. It's not clear that this is going to be enough. Hospitalizations are up over 100%. ICU admissions across the state up over 100%. We have over 1,500 people in the state right now hospitalized with COVID-19. And there's reduced capacity because we have a lot of non-COVID patients who are hospitalized when in the spring, a lot of them weren't in the hospital. So we clearly have to roll things back. We're going in the wrong direction.
But maybe on one front, we're going in the right direction because today Britain administered the first doses of an approved COVID-19 vaccine. And I'll state the obvious, it's a big step. So if Americans begin receiving these vaccinations either later this week or later this month, what does the next 12 months look like?
Yeah, Ed, this is such a massive step, and it's amazing. I mean, and hopefully soon in the U.S. we'll be following suit. Remember, what we're hearing is the goal is to have 40 million vaccines before the end of the year, and hopefully we can get all those. We have to roll up our sleeves and get them into our arms. That's 20 million people receiving the first dose. Remember, it's going to take about another 3 or 4 weeks to get that second dose in, and then about a week or two after before we really develop full immunity. So we actually are hearing, though, that there may be some immunity even after the first dose. So that is good news.
But there are 30 million people that live in the United States.
Right.
20 million is just a speck in. Is it not?
It's true, and that's the point of why we have to keep doing our other infection control measures that we've heard about and do that at the same time while we increase vaccination in the U.S.
Which is wearing a mask, which is what you all recommend to do. If you still get this vaccine, do you still need to wear that mask?
Yeah, for all the reasons that we just heard what Ed was saying, it is very important that we continue to wear the mask. You heard, President-elect Biden, that he said one of his major 3 initiatives is masks, mandatory masking as much as possible for the first 100 days. And that is a step in the right direction. But that will also decrease transmission.
I'm sorry to interrupt. Even if you get the vaccine, you're saying we have to wear a mask?
Well, yes. I mean, in the beginning, we need to, because remember, there's still not going to be enough immunity across the country, and we still have to hear what the vaccine is doing to decrease transmission. We know it decreases infections, we know it decreases severity of infections, but we have to learn more overall about transmission.
Yeah, I just want to make that clear. Okay, thank you.
And see, these are very specific questions that when I go to the gas station, I get them at the gas pump. If my grandparents received the vaccine before other members, honestly, I got this question, before the other members of the extended family, is it okay to resume normal family activities? Those are the questions that we're getting.
That's right, and because of what we just talked about with Maria, it's not just vaccination alone for now. It's vaccination plus masking plus distancing, all of these in the beginning. Now, next year, at some point, is it possible that we could hear that we can take off our masks? That is possible, but it probably will not be in the first half of the year.
This is not fair, Doc, because we're out of time, but Dr. Walensky, the head of the CDC, grade A, right?
She is the real deal. I've worked with her before at Hopkins and in the Harvard program, and she is smart. She is a consensus gatherer, and she's worked with HIV and AIDS, which a lot of her passion and her research and her care has been done to the vulnerable populations, which we're hearing about again with COVID-19. The virus, it does not treat everyone equally, and she's going to be a great commander.
Dr. Todd Alleran from South Shore Health. As always, we appreciate it. Be well, doctor.
Good to see you guys.
Great to see you, Doc.
Thank you.
Well.